Gallbladder surgery is one of the most common operations performed worldwide. For most patients, it's a safe and routine. But there is one complication that surgeons always work carefully to avoid: bile duct injury. Although rare, it can have serious consequences for the patient. I'm Dr. BenMaamer, board certified general and vascular surgeon, and today I want to explain what bile duct injury is, why it happens, and why it can become such a challenging problem. So what the bile duct does? The bile duct system carries bile from the liver to the intestine. Bile is essential for digestion, particularly for breaking down fats. This system includes small ducts inside the liver, the common hepatic duct, and the common bile ducts, like a tree, and the trunk is the common bile duct. Together they form the pathway that allows bile to reach the digestive tract. So where the gallbladder fits in? The gallbladder stores bile produced by the liver. When we eat, especially fatty foods, the gallbladder releases bile into the bile duct system. During gallbladder surgery, we call it cholecystectomy, so removal of the gallbladder is removed from this duct system. This is where surgical precision is critical. So what a bile duct injury is? A bile duct injury occurs when part of the bile duct is cut, or clipped, or burned, or mistakenly removed during surgery. Because the bile duct is the main pathway for bile drainage, damage can disrupt normal bile flow. This may lead to bile leakage or bile duct obstruction. So why this complication happens? Most bile duct injuries occur because of anatomical confusion during surgery, especially the emergent one. The bile duct, our surrounding structure, can sometimes appear very similar. Inflammation from gallbladder infection can also distort the anatomy, making identification more difficult. That's why surgeons follow careful techniques to clearly identify these structures before dividing them. So what are the possible consequences if a bile duct injury occurs? Several problems may develop. These can include bile leakage into the abdomen, so the bile will be leaking outside the intestine. Infection, narrowing of the bile duct, we call it stricture. Long-term liver problem if bile cannot drain properly. In some cases, patients require complex reconstructive surgery to restore bile flow. So why, and this is very important, early recognition matters. When bile duct injury is recognized early, treatment can often begin sooner. Diagnosis may involve imaging studies, bile duct studies, endoscopic procedure. Early management can reduce complications and improve outcomes. How these injuries are managed? Treatment depends on the type and the severity of the injury, and management may include drainage procedures, endoscopic stent placement, surgical reconstruction of the bile duct. Complex injuries may require specialized hepatobiliary surgical care, and that's in certain centers. So why surgeons take this seriously? Bile duct injury is considered one of the most serious complications of gallbladder surgery. Although uncommon, it requires careful evaluation and expert management. That is why surgeons place great emphasis on proper identification of anatomy during surgery. One important takeaway: gallbladder surgery is generally very safe, but understanding the rare complications help explain why surgeons approach the anatomy with such care. The goal is always to perform the operation safely while protecting the bile duct system. Bile duct injury remains one of the most challenging complications in gallbladder surgery. Fortunately, it is uncommon, but when it occurs, early recognition and appropriate management are critical. Understanding the anatomy and surgical technique is key to preventing these complications. This is Dr. BenMaamer. If you believe healthcare in America needs to change, hit follow.